Being a palliative care nurse for the last 8 years, I've been faced with many difficult conversations, and none seem to be as difficult as the topic of hydration at the end of life. This led to my PICO question of: is artificial hydration an effective symptom management tool for end of life cancer patients who are weeks to days from death? With the use of the Athabasca Library, Ovid, and studies from physicians that I work with, there seems to be no clear yes or no answer. Many studies were conducted post death, and one very limited randomized control study shows no improvement on quality of life or improvement of symptoms such as nausea, pain, confusion, and feelings of thirst. The concern is, as the body shuts down, requirements for fluids and nutrition become less, and adding to it can cause edema of the extremities, pulmonary edema, and an increase in oral secretions and discomfort in the patient. Many common themes did arise from the studies. Early palliative care improves the outcomes for both patients and families. It allows the patient to have their wishes for end-of-life care known and understood by both family and the healthcare teams. Good mouth care at end of life provides better symptom management than hydration. It also helps to alleviate this feeling of thirst to our palliative and end-of-life patients. And above all, autonomy is the number one thing. Despite our worries, patients' wishes always come first in their care. Further research on end-of-life hydration is required, but difficult, as the potential for moral and ethical concerns arise. The two number one things that I found in the studies was that confusion and family concerns regarding hydration were the reasons that these patients were removed from the studies. Also, not everyone has a predictable trajectory for death, which makes timing of studies difficult. The interventions that I would like to have in place to help with this is starting at the nursing level, especially in community nursing, as they are the regular eyes and ears of the palliative care teams, as well as the families. Regular in-services where practice on having difficult end-of-life conversations occur, and showing methods of symptom management which can be shared with families, which allows families the feeling of they have something that they can do then. And regular support with nurses who have palliative clients. Also, to continue with the assessment of how the interventions are going, regular debriefs with nurses and case conferences will help to continue on building the skills that were set before them. And it will help to assess the needs of the staff on an ongoing basis. Overall, palliative care is a rapidly changing part of nursing, and the need for ongoing education and support to all frontline staff will develop trust and faith in patients and families who are faced with the end-of-life choice. The hope for all people involved in palliative care is that there will be an increase in funding to allow further research on what is best symptom management for our patients. Thank you.